name is Nicola. I'm from the University of Oxford and one of the scientists of tomorrow. I'm here at the ESC Congress in London, and with me today is Dr. Margaritis. He is the winner of the Young Investigator Award in Aging and Senescence. Welcome, Marios,
Thank you,
and very many congratulations on your achievement.
Thank you very much.
It's excellent. So I wonder if you could just outline for us the rationale for the study that you presented.
Of course, my pleasure. So as you know, telomeres, the short telomere length, is a hallmark of cellular senescence. And given that cardiovascular disease incidence rises dramatically with age, there have been many epidemiological studies trying to assess a link between short telomeres and prediction of cardiovascular disease outcome. But the results so far have been a bit conflicted. So we designed a clinical outcome study to evaluate the use of measuring telomere length as a clinical predictive tool. So we recruited 500 patients who had an acute coronary syndrome and were undergoing a percutaneous coronary intervention, and measured telomere length in their blood. At the same time, we also recruited 648 patients undergoing bypass surgery, so for stable ischemic heart disease as an elective procedure, and measured telomere length in their blood as well. We followed the patients prospectively for 1 year and show whether they could be used as a clinical tool.
Okay, and what were your main findings?
We found that short telomere length in whole blood, so the one that is derived from leukocytes really, can predict postoperative outcome in PCI patients, in patients undergoing PCI, both for all-cause mortality, cardiovascular disease-related death, as well as new onset non-fatal acute coronary syndromes. We also found that short telomere length was an independent predictor of incidence of postoperative atrial fibrillation following bypass surgery. And an important point is that by doing our Cox regression analysis, we found that these associations, this predictive value, was independent both from chronological age and the traditional risk factors.
Okay, so that's a very, very important insight. So you show that telomere length is reduced with oxidative stress, and this predicts adverse outcome post-vascularization. So how can we apply what you've learned to benefit those patients?
So yes, you went a bit ahead. That was our next finding, was that we performed a clinical association study to see how we could assess what the mechanism was behind our findings, and we found that high oxidative stress in each tissue reflects the telomere length in that specific tissue. So we feel that telomere length is a biomarker that reflects the underlying oxidative stress, and that gives us a tool to actually intervene, because we might not be able to elongate telomeres or act on that, but we can act on oxidative stress, and that can be a cause for the cardiovascular disease pathogenesis.
I see. So what sort of intervention do you envisage?
So it was mentioned by Professor Blackburn as well, the Nobel laureate that presented her amazing findings before my talk. She mentioned that exercise, things that we already know, basically exercise, living a healthy life, as in not being stressed. Stress can lead to shorter telomeres. I know. And proper diet, diet rich in omega-3 lipids, is also linked to elongated telomeres. So these are well-known interventions, but still we fail to do that in preventive medicine. So the value of my findings is that we would possibly be able to identify those patients who would most benefit from acute interventions in their lifestyle.
Okay, so we follow the healthy lifestyle that we know we should follow, but don't necessarily, but your work has told us one of the main reasons why we should do that. Exactly.
It's one step. We feel that it's one step towards personalized cardiovascular medicine for each individual of our subjects or patients, study subjects or our patients.
Sure, and an important step, I'm sure, and a very interesting study. Thank you so much for sharing it with us.
Thank you very much.